Omicron variant and the clinical symptoms of the infected. We had held experts discussion, and on top of the 9th version, we've made some revision to the content, and that's how the 10th version has taken shape. The core rationale in the 10th version of the diagnosis and treatment protocol is that we will manage and treat COVID as a Class B infectious disease. We've made some adjustments in the following aspects. First, we've adjusted the way and measures of management. When we admit patients, we do not require centralized quarantine arrangement. In accordance with the measures for management of the Class B infectious disease, some patients can have home-based treatment, and some may go to hospitals for treatment. All health institutions at all levels can admit the patients with the COVID infection. When COVID was managed as Class A infectious disease, all the patients were admitted to designated or quasi-designated hospitals for treatment. The second major change is in the criteria of hospital discharge. In this aspect, we do not have PCR testing. As you may know, in the 9th version and previous versions of diagnosis and treatment protocol, we require a CT value above 35 and a negative PCR test result before the patient can be discharged. Since we've downgraded COVID into Class B infectious disease and we do not have a quarantine requirement for patients, therefore the physicians are provided a bigger discretion to consider the physique of the patient. The 10th version do not list a negative PCR testing result as the condition sine qua for the discharge of the patient. Rather, it is based on the underlying disease and the clinical symptom and their recovery that the clinicians will give the final conclusion whether the patient can be discharged or not. But even without a PCR testing requirement, we still advocate the patients discharged from hospitals to have better rest at home, and we do not recommend you to join large-scale social gatherings. The 10th version of the protocol has further enriched the ways of diagnosis and treatment. For example, in diagnosis, antigen testing has been included as one of the diagnosis tool. Antigen testing has a high sensitivity over patients with a high viral load. As the antigen testing technology matures, patients with COVID infection, especially those with a high viral load, can be easily tested and diagnosed and confirmed with an antigen testing. Besides, it is simple to be used, which facilitate home-based, self-administered testing. That's why we've added it into our diagnosis toolkit. In the clinical treatment, we've been making a joint use of the valuable experiences accumulated in the past 3 years. We emphasize early intervention, even for mild cases, particularly for elder citizens and patients with underlying diseases. Early intervention is more emphasized on patients as such. We emphasize targeted treatment to prevent the deterioration of mild cases into severe cases. Second, we standardized the treatment of severe cases. We've improved the early warning signals and red flags of the severe cases. By understanding these red flags earlier and better, we can more timely prevent the deterioration and better treat severe cases. Oxygen treatment, prone position ventilation have also been emphasized in the treatment of severe cases. Third, the 10th version keep to equal emphasis on TCM and Western medicine with a particular focus on the unique advantage of TCM in the treatment. Fourth, we've been emphasizing the doctrine of giving equal emphasis to the treatment of COVID and underlying diseases. Many elder patients suffer from comorbidities, and COVID may exacerbate the comorbidity. That's why we should emphasize not only the treatment of COVID, but also the targeted treatment of underlying diseases to use multidisciplinary consultancy and better implement the treatment and facilitate comprehensive recovery of health of the patients. Thank you. Next question goes to the journalist on the second row from the left side. With the CCTV, the 10th version of the diagnosis and treatment protocol is 10 months away from the previous version. What are the changes in our understanding of the pathogenicity of Omicron? I'd like to invite Mr. Wang Guiqiang to take the question.
Thank you for your question. With the circulation of Omicron, we have paid continuous attention to the pathogenicity of Omicron virus. As you may know, that after infection, the pathogenicity have decreased while the spreading of the disease becomes faster as compared to the original virus and previous variant of the virus. The pathogenicity is reducing. For Omicron infection, we emphasize symptom-based support and respiratory treatment and support. Once a severe disease happens, for example, once pneumonia happened, we need clinical support. For the Omicron variant circulating in China, it were mainly BA.5.2 and BF.7. The clinical symptoms of Omicron infection are coughs, dry throat, and fever, with some persons suffering from pneumonia. However, pneumonia cases are reducing as compared to Delta. However, we emphasize early diagnosis and treatment of pneumonia, especially with elderly people and people with basic conditions and immunocompromised patients. Early identification, early treatment, and early oxygen treatment are very important for these patients. We also identified that although we have reduced the pathogenicity of Omicron, and elderly people without vaccination are suffering from severe disease, so we still emphasize vaccination and booster dosage. Through a series of measures, we hope to reduce the severity of Omicron infection and reduce the fatality rate. For Omicron variant, although the pathogenicity is reducing, we should pay continuous attention to the further changes of the virus, including the potential risk of the variations, mutations of the virus. Based on the features of the new variant, we will adjust the protocol. Thank you. Now we allow further questions.
第二排第三位女记者。
Thank you, moderator. From TCM Daily, as compared to the 9th version, what are the changes in the 10th version in TCM treatment? The floor is given to Mr. Jia Zhongwu. Thank you for your question. When the pandemic prevention enters into a new stage, especially when COVID-19 is classified and managed as a Class B infectious disease, our priority changed from prevention to protecting health and preventing severe disease. So we also change our priority in our work. However, we maintain our continuity of treatment plan. We believe that the central TCM pathogenesis didn't change. It still belongs to the plague scope, the scope of plague. The main reasons of the disease is of getting the pathogenetic factors. So we didn't make dramatic changes to the next version. We maintain the clinically tested effective programs within the next version and maintain the continuity of the plan. Second, our program are more targeted. Most of the patients are suffering from upper respiratory tract infection. Some of the patients suffer from lung infection and with lasting coughs during the recovery stage. In the milder cases, we add symptoms of exterior symptoms, and also in severe and critical cases, we add yang qi decline and lung depression symptoms. And in recovery stage, we add coldness, exudated, poorly ventilated lungs symptoms. In this way, we can better satisfy the clinical requirements for treatment. Thirdly, the revised protocol is becoming more practical. We add medicines and methods in line with different classes of disease. And for severe disease, we summarize the major symptoms. Targeting at those symptoms, we prescribe medication so as to facilitate clinical application, especially to guide the usage by non-TCM doctors. Fourthly, we emphasize preciseness. The current revision is carried out by joint efforts from National TCM Management Bureau and clinicians in Guangdong, Chengdu, and other cities. We have carried out many rounds of research and argument, and we have take advice from experts across the country, and finally we come to the 10th version. That's why it becomes more precise and more scientific. Thank you. We allow further questions. From China Daily. In the current version, we have removed the TCM treatment during the medical observation period. What are the considerations? And when we get symptoms of COVID-19 infection, how can we have a TCM treatment at home? Do we need to go to hospitals? The floor is given to Mr. Liu Qingquan. Thank you for your very important, very good question. The issuance of the 10th protocol was a recent issue. Many doctors approached me to ask the same question. I think this is a major adjustment in line with the changes of the national prevention and control policy against COVID-19. The previous TCM treatment during the medical observation period was proposed based on two reasons. First, after PCR screening, we identify PCR positive people. Although they are not confirmed with COVID-19 infection yet, they are suffering from some of the symptoms. For this group of people, we carried out TCM intervention back then. Through TCM intervention, we can prevent the disease to happen and reduce the number of confirmed cases. This is an important practice of TCM to prevent disease. Second reason is that there are many cases of fever like normal cold, influenza, or COVID-19. Without a precise diagnosis, during the circulation of disease, some people may need medical observation. And during the medical observation, we can have a further diagnosis and quarantine this group of people from preventing the prevention of the disease. Normally, this group of people will suffer from fever. TCM treatment will cure the fever and prevent disease progression. Now, COVID-19 is classified management as B-class infectious disease. We do not identify asymptomatic infection cases and close contacts. So medical observation period was used in the previous 3 years to reduce the number of confirmed cases and stop the progression of disease. However, after the adjustment of COVID-19 as Class B infectious disease, in the new version, we remove this part. It does not mean no treatment will be provided after infection. Milder cases should not go to hospital, resulting in overcrowded hospitals, overburdened hospitals. If you identify yourself with COVID-19 symptoms, please don't feel nervous. You just follow the TCM intervention guidelines for COVID-19 infected patients to select the drugs for home-based treatment. However, there is an important reminder after applying TCM treatment and other treatment, if there is no symptom alleviation within 48 hours, please go to the fever clinic as soon as possible so as to prevent progression of disease, especially for elderly people, although they don't suffer from extreme fever, but they are suffering from fatigue, loss of spirits. Please do send those elderly people to hospitals. Thank you. Now we allow further questions.
List from the fourth row on the left side, please. Thank you. With the Phoenix TV, grassroots level health institutions provide convenient health services to the general public. As we downgrade COVID, they also play an important role in the management of the communities. And what are their specific roles? Mr. Li Yongjing is taking the question. Thank you for your concern and interest in health institutions. We always say prevention and treatment are equally important, and prevention is very important. We must advocate the general public to have healthy habits and reduce the risk of infection. I like to take our health center in Jinsong community as an example. First, we make full use of the role of family physicians. We have a list of people at risk, and we share this list. We know whether they have gotten vaccination, whether they have underlying diseases, and we know the list of the maternal women and the newborns. We have a red, yellow, green, 3-color risk zoning system to better manage the list of people at risk. Second, we've been advocating the citizens in our community to get shots in their arms as fast as possible. We have given them telephone calls and advocate the full course vaccination and the vaccination of booster doses. We also deliver vaccines to the elderly who are inconvenient to travel outdoors. Third, we provide health guidance and scientific knowledge. We provide communication to the citizens in our community and let them understand that each person is the number one accountable person for their own health. They should have good hand hygiene, wear masks, have good ventilation of their rooms, and improve personal protection. We also remove the misinformation, including the blindly or panic buying of medicines, and we suggested that they use medicines with the guidance of their physicians. Next question goes to the financial center of CCTV. Among the critical cases, there are several major types. What are the focuses of our treatment in treating these different types of severe cases? I'd like to invite Mr. Wang Guiqiang to take the question. Thank you for your question. The overall pathogenicity of Omicron has been declining. However, for the elderly and people suffering from underlying disease may still deteriorate into severe cases, including severe pneumonia or respiratory failure. To better guide the clinical practices in the 10th version, we emphasize that we define severe cases differently, and that is the pneumonia caused by coronavirus. And if they see the exacerbated underlying diseases, then it is not considered as a severe case triggered mainly by novel coronavirus. We look at the sets at rest and the hypoxemia symptoms, and we have a respiratory tract intervention. So first, in terms of its definition of severe cases, if the sets at rest is smaller than 93%, or the PaO2 to FiO2 is lower than 300, if the patients suffer from hypoxemia, or their symptoms cannot be explained by basic pulmonary diseases or cardiogenic pulmonary edema, then these are considered as severe cases triggered by novel coronavirus, and they will be provided with respiratory support. Of course, we also take care of the underlying diseases. We'll provide comprehensive treatment across the board. And we need multidisciplinary cooperation to treat the pneumonia, the multi-organ failures, and the exacerbated underlying diseases. We depend on the multi- and cross-disciplinary cooperation to reduce the risk of death. The elder citizens, in particular those with underlying diseases and without vaccination, are often seeing deterioration because of the underlying disease. So the ongoing and regular intervention into the underlying diseases are equally important. Next, the question goes to the journalist from the second row on the right side, please. Thank you, Mr. Moderator. With CGTN, the prevalent variants in China are BA5.2, BF7, but in some countries, BQ1 and XBB are becoming the dominant variants, and such cases are also tested in our country. Is the current TCM protocol also applicable for the treatment of infections with the new variants? Mr. Liu Qingquan is taking the question. Thank you. That is a very important and interesting question. It's difficult to have a precise judgment at the current stage. When TCM diagnoses the disease, we look at the symptoms and seek the causes. When we understand the causes, we talk about the treatment. Based on available literature and information, the clinical symptoms of BQ1 and XBB are not much difference with the clinical symptoms of the patient suffering from the infection of the domestically dominant variants. However, we haven't seen the actual cases from other countries. In TCM theory, we don't see a difference of a great distinction, because according to TCM doctrines, the pathogenicity is the same, and we can still use the current way of treatment. However, from the original strain to different variants, we have found that the diseases are not only in respiratory tracts, but there are also vomiting, emesis, bloating, and poor diet, poor appetite, other GI functional changes. Thank you. Next question, please, goes to the journalist from the first row on the left side. With Xinhua News Agency, the 10th version of diagnosis and treatment protocol has removed moderate cases and added medium cases. Why was there such a change, and what is the significance in improving treatment? I'd like to invite Madam Guo Yanhong to take the question. Thank you for your question. Yes, indeed. In the 10th version of the diagnosis and treatment protocol, we've removed the moderate cases and added medium cases. In clinical symptoms, moderate cases refer to the most common symptoms suffered by patients. At the early stage of outbreak, the pathogenicity of the novel coronavirus was strong, and a great majority of the patients suffer from pneumonia. Therefore, we had the way of classification of mild, moderate, severe, and critical cases. With the constant evolution of the virus, in particular, since the outbreak of Omicron, we see the gradual weakening of the pathogenicity of the virus. Its clinical symptoms have also seen major changes. Most of the patients suffer from upper tract infection, respiratory tract infection.
The percentage of pneumonia patients are reducing. That's why, to better reflect the features of Omicron, we make adjustment to the classification method, remove the moderate cases and medium cases. Medium cases means that fever days, more than 3 days, and also pulse oxygen larger than 93. And the pulmonary scan result showing typical pneumonia symptoms. Well, as compared to severe disease, pulse oximeter should be less than 93, and there is a severe lung problems. So the adjustment of the 10th version is based on the severity of the disease. That's why we have mild, medium, severe, and critical disease in line with the clinical results. The adjustment enable the clinicians to make a comprehensive judgment of the disease severity and come up with comprehensive treatment accordingly. Based on the changes of the virus and based on the changes of clinical symptoms, that's why we changed the classification method. Thank you. Now we allow further questions. Thank you. From Southern Weekend. And for severe critical disease, in the last version, the age threshold was adjusted, was 60. Well, in this version, it was adjusted to 65. What are the considerations, and why for people below the age of 65, the disease severity is reduced? And what should we pay attention to? The floor is given to Mr. Wang Guiqiang. In the 8th and 9th version for severe and critical disease, and we refer to elderly people and people with basic conditions, pregnant and lying women, and other vulnerable groups. We want to identify those vulnerable groups for early intervention and early treatment. Well, there is a minor adjustment this time. In clinical practice, we found out that for people above the age of 65 with basic conditions without vaccination, severe disease percentage are higher. According to clinical statistics, we identify this problem. That's why there is a minor adjustment in this version. Whether it is age 65 or 60, we emphasize that people with basic conditions without vaccination will suffer disease, will more prone to severe disease. That's why we include them into early intervention and early treatment. Once problems are identified, please go to hospital as soon as possible so as to reduce the severe case and deaths. About severity rate, we take note of online discussions about this. Some experts said that there are 3% to 4% of severe cases, and some people say 1%. Other person say within some regions, the percentage is even lower. I want to make it clear here. The severity rate means the number of severe cases divided by the totally admitted cases. Multiply 100%. That's the severity rate. However, different hospitals may administer different number of cases. So different hospitals may come up with a different rate. In Peking University Hospital, we have ICU wards and quasi-ICU wards, which provide oxygen therapy and which receive a lot of less severe cases. So severity rate at this hospital session is lower. So the severity rate is also changing. For mild, medium case, they will not visit hospital, so you will not see them appearing at the denominator. So severity rate need to be more precisely calculated when large number of data came into being. Now we allow for the questions. Thank you. From cable TV. And for comprehensive hospital and special hospital, how can they use TCM treatment to provide clinical care? The first given to Mr. Jia Zhongwu. This is a very important question. And the question I want to elaborate on. The combination of TCM and Western medicine is a unique advantage enjoyed by China in COVID-19 treatment. In the COVID-19 process, treatment process, we have come up with a combination of TCM and TCM with set up medical teams. And whether it is a comprehensive hospital, specialty hospital, they will implement combination of TCM and Western medicine combination to carry out clinical treatment to protect health and prevent severe disease. And will combine the advantage of Chinese medicine and Western medicine to treat our patients. The guideline issued by the Interagency Task Force and the notice issued by the task force have emphasized the requirements of combining Chinese medicine and Western medicine in providing the treatment. And we set up work cooperation mechanism to have hospital-level expert group with participation from TCM doctor and Western medicine doctor, and they will carry out homologous and standardized medical treatment combining Chinese and Western medicine in line with national plan. And we have TCM doctors and Western medicine doctors visiting the wards together, and they will discuss one case together and come up with a treatment plan together. In curing severe and critical disease, TCM doctors have accumulated many experiences. These experiences are reflected in the 10th version of the treatment plan. In treating severe and critical disease, and we have come up a symptom-based treatment method, and which is more targeted. TCM doctors with abundant clinical experiences, they will use this plan in line with their personal experiences. They will use the treatment plan in a contextualized way. Well, for people who are working in comprehensive hospital, they can follow the treatment plan to use TCM medicine based on the symptoms to achieve the best treatment result. In the next version, we will carry out a training about the TCM treatment method within the 10th version so as to play the role of TCM in COVID-19 treatment. Thank you. Now we allow further questions. Thank you, moderator from Beijing radio station. Community-based hospitals and institutions provide very convenient medical services to the public. But once they encounter severe patients, how can they pair up with comprehensive hospitals so as to ensure timely treatment for severe cases? The floor is given to Mr. Li Yongjin. Thank you. Thank you for your attention given to community-based health clinics. Community-based health clinics should play the role of first aid before hospital admission. When we make adjustment to the COVID-19 prevention method, community health clinics help the hospitals to transfer severe disease to the hospital, and we have 7 doctors, 3 nurses, and 2 drivers. They are involved in patients' transfer to ensure that severe patients can be transferred to large hospitals. Second, we open up our fever clinic 24 hours to ensure adequate supply of 4 types of medicine and send medicine to people's home so people can get access to the medicine at their doorstep. Certainly, we have a better cooperation with the Hospital Alliance and Comprehensive Hospital.
We provide telemedicine online and keep the transfer channels unimpeded so that the severe cases can get timely treatment. The health centers in community have done the utmost of our efforts to provide IV transfusion oxygen support to the mild cases and those who discharged from hospitals. Next question goes to the journalist on the second row from the left side. With the People's Daily, in the treatment of severe cases, what are the roles of TCM? What are the major means of diagnosis and treatment? I'd like to invite Mr. Liu Qingquan to take the question. Thank you for your question. That is highly relevant. Equal emphasis of TCM and Western medicine have been the Chinese experiences that we've accumulated in the past 3 years in the treatment of severe cases. Severe cases, in particular pneumonia, may lead to high fever. And in TCM theory, any colorectal disease point to lung dysfunction. Therefore, we use laxative formulations. There are many classical laxative formulations from the Han Dynasty, including the lung ventilation decoctions and the Da Chai Hu decoctions. These formulas can not only remove the fever and can also curb the further progression of the disease and prevent deterioration to the critical cases and thus reducing the fatality rate. Severe cases, in particular the elder patients, can easily lose vigor. And in TCM, we timely administer the ginseng decoctions with the ginseng as the only or auxiliary ingredients to prevent convulsion or dehydration. They play an instrumental role in preventing the progression into critical cases. Critical cases patients usually depend on ventilators for treatment because they suffer from sepsis, shock, or multi-organ function failures. So we use acupuncture and herbal medicines in combination, including acupuncture decoctions and the herbal liquid injection. We have customized an individual solution and formula for any patient. That is also the essence of TCM. The combination of TCM can help the patients to live without a ventilator, correct sepsis and shock, prevent multi-organ failure, and minimize fatality. TCM treatment is like a combination and array of boxings. It is a full toolkit. When it is used in combination with the Western medicine, we have seen the toolbox for treating critical cases with Chinese characteristics taken shape. Next question, please.
谢谢主持人。健康报记者提问。
With the 健康报
我们发现诊疗方案当中对于出院
in
标准
the
做了较大
10th
的变化。
version, there is major change to the criteria of discharging from hospitals. For example, the time for temperature coming back to recovery has shortened from 3 days to 1 day. Is it to shorten the hospitalization time? Thank you for your question. Madam Guo Yanhong is taking your question. Yes, indeed, there has been major change to the discharging criteria. And this is based on our response strategy adjustment. It is also for realizing and implementing the clinical treatment requirements. An adjustment has come into place based on our experiences, the progression, the development, and the treatment of the diseases, and our further understanding of the pattern for treatment at an early stage of the outbreak of the pandemic, given a strong pathogenicity of the virus, to minimize the pandemic's impact on people's health, in particular to curb our transmission. Our country adopted rigorous management, including classifying it as a type Class A infectious disease, and we admit and treat all those cases into designated hospitals with a view to increasing cure rate. At the same time, see that we reduce and curb is our transmission. So back then, we had rather rigorous criteria for the patient discharging from hospitals. That was considering the health status of the patients and minimize the potential of our transmission. So back then, we had a requirement of PCR negative testing result before the patient could be discharged. We were also taking into consideration the image of the lungs, the clinical symptoms, and we have added home-based medical observation. And back then, all these measures were not only considering the health of the patients, but also preventing our transmission. With the constant mutation of the virus and the attenuation of its pathogenicity, we are now managing and categorizing COVID as a Class B infectious disease. Our focus has pivoted from preventing infection to preventing severe cases and improving treatment. The patients with COVID are no longer required to have a centralized treatment. They can make voluntary choices as to home-based treatment or medical institutions treatment. That's why in the new version of diagnosis and treatment, we've given special attention to all these changes. We no longer use a negative PCR testing result as the necessary condition for discharging from hospitals. Physicians will have their own discretion to assess the health physique, the rehabilitation of the patient before they come to the decision whether the patient can be discharged or not. If the patient's rehabilitation is good, the vital signs are normal, temperature is normal for over 24 hours, and there is a substantial improvement of their lung images, the patients can take oral medicine for continual treatment, and there is no sign of comorbidity. Then the patients are ready to be discharged. So based on the comprehensive assessment of the patient can be discharged if all these conditions are met. By so doing, we can shorten the hospitalization time and increase the efficiency of the health institutions' resources. The next question goes to the journalist on the fourth row on the right side. Thank you, Mr. Moderator. With the daily economic news, in the antiviral treatment, what are the major roles of small molecular medicines? I'd like to invite Mr. Wang Guiqiang to take your question. Thank you for your question. Since the outbreak of the pandemic, we have been constantly exploring effective treatments. We have accumulated valuable experiences. However, up till now, there is no panacea for the treatment. We still need comprehensive treatment, including targeted treatment, antiviral treatment, oxygen treatment, immune boosting, and anticoagulation. For multi-organ failure, including respiratory failure, we have a respiratory support and organ support treatment. Antiviral treatment is an important component of the comprehensive treatment package. Antiviral treatment includes small molecular medicines with 3 on recommendation, immunoglobulin, and monoclonal antibody, and all these are antiviral treatment tools. Small molecular vaccine medicine
and stop or reduce the duplication of the virus so as to reduce the symptoms and shorten the course of the disease and reduce the severity case so as to reduce severe disease and death. And it is easy to be used, and it can be used at community health clinics and at hospitals. We believe that for taking small molecule drugs, it's better to take it within 5 days of infection. After 5 days, the effect will be reduced. And also, it should be used for severe and highly vulnerable group of people, that is elderly people with basic conditions without vaccination, to prevent severe disease. While for milder case, the use of a small molecular disease is not recommended. And also, there is an interaction between drugs. So the use of small molecule these drugs should be under the guidance of the doctor. The use of the small molecule drugs can reduce severe disease and death and hospitalization rate. However, we should focus on the applicable symptoms and use it under the guidance of doctors. Thank you. Now we allow further questions. Thank you. From Guangdong radio station. PCR and antigen tested negative patients are still suffering from lasting symptoms. What are the treatment methods provided by the test protocol? The floor is given to Mr. Liu Qingquan. Thank you for your question. This is a question of common concern for every patient who have just experienced COVID-19, who has just recovered from COVID-19 are paying attention to the lasting symptoms from COVID-19 infection. The 10th version came up with 3 suggestions. The first is targeting at people who are suffering from fatigue and pain and stomach weakness. For example, people who have a poor appetite, diarrhea, and who have a swollen stomach or bloating. For people suffering from these symptoms, we recommend a typical formula called 6君子 decoction. The second symptom or group of symptoms are fatigue with sweating, palpitation, and with weakness of lungs. We recommend 沙参麦并冬 decoction, 竹叶 ointment, and other typical formula. The third group of symptoms are coughing without phlegm or blocked lungs. We recommend 射干麻黄 decoction to treat these symptoms. The 10th version pay special attention to the person who have turned negative but still suffering from lasting symptoms. There are many recommended formulas, and medicines and acupuncture are both recommended, and massaging also recommended for recovering patients. Thank you. We allow the final 2 questions because of time limit. Thank you. From the paper, as compared to the last version, there are many additions in this version about plans for children's treatment. What are the impact of this version for children's treatment? The floor is given to Mr. Jia Zhongwu. Thank you for paying attention to this point. We give priority to elderly and kids, elderly people and younger person. They are vulnerable groups of person. These are the experiences we have gained in the past 3 years, and these are the focal points of the 10th version treatment plan. In the next version, the pediatric experts come up with the basic principles for treating children in TCM medication, but we didn't recommend specific formulas and decoctions. However, in the 10th version revision, pediatric experts in line with the previous experiences and the physical features of children, we come up with a relatively comprehensive treatment plan, TCM treatment plan for children. We classify the disease into mild, medium, and severe disease, and recommend different prescriptions and ready-made TCM treatment and non-medication treatment for different disease types. And for severe and typical critical disease, based on the adults plan, we also come up with guidance for children based on their features. It's difficult for children to take medicine, especially for people, for children of young age. It's a challenge to give them medicine. So in the current version, we focus on curing the causes and paying attention to the children's feature of being sensitive to external stimulations. We come up with massaging and acupuncture treatment for children so as to adjust the yin-yang and come up with a better treatment result. In this way, we can reduce medication for children. Thank you. Now we have the final question. Thank you, moderator. From China News Agency, community health center can ensure medical services for the public in the treatment of COVID-19. What are the work of community health centers so as to satisfy the health needs of elderly people, pregnant, young people, and children? The floor is given to Mr. Li Yongjin. Thank you for your question. In the treatment of COVID-19, community health center should do the following work. First, ensure drug or medication supply. And they should keep a large reserve of fever medicine, painkiller, cough medicine, and expectorants, and so as to prescribe antiviral drugs to COVID-19 patients. Second, paired up with elderly homes. Our health center have shared information with 3 elderly homes with 107 elderly people, and we provide them with medical services, and also we have set up a 23 family doctor team and paired up with 360 living alone elderly people within the community. Third, we help to transfer elderly and severe patients to large hospitals. We keep contact between the hospital and elderly people who need transferring, and we set up WeChat-based diagnosis group and arrange experts to be stationed at the first aid center so as to help severe disease patients to find hospital beds at large hospitals. Fourthly, and we provide medical services to send in patients, and we have signed up with 3,657 elderly people above the age of 65, provide online medical treatment for them, and we send out pulse oximeter and guide family-based oxygen therapy and guide the medication within homes.
Our center is also root-level health institution that provides online treatment, online bill settlement. And just by staying home and have online services, they can have the one-stop service of the health service package. And fifth, with making good use of TCM. With the guidance of national experts, the Chaoyang district has promoted 4 contextualized formulations, including the formulations for prevention treatment, for fever as fever medicine, and our center has been in charge of its supply and its effective use. On today's press conference, our guest speakers have shared us information related to diagnosis and treatment 10th version of the protocol. After we downgrade COVID, there are many supporting measures for implement. We will invite competent authorities to continue to join us to provide press conferences, and please stay tuned. We conclude today's press conference. Thank you.